Here is the infographic that has information about the Philippine General Hospital COVID-19 guideline way back 2 years ago and at present F2F. Way back 2 years ago, the PGH workers has a PPE during brief interactions with patients. They need to wear cap, face shield, N95 mask, gloves, and disposable gown. And when performing close contact with patients, coveralls, face shield, N95 mask, dedicated shoes, surgical caps, double gloves, shoe covers, and scrub suits. Personal protective equipment, often known as PPE, is equipment worn used to reduce exposures to risks that can result in significant workplace disease and injuries. So the proper usage of mask is first, only wear a size for which you have been appropriately fit tested. Next, when removing your mask, never touch the front of the mask. Always discard the mask after procedures if contaminated with blood or other bodily fluids from patients or when mask becomes incapable of forming an effective seal on the face. Also double your mask if you are going to perform the procedure. When wearing a mask, a person is also considerably protected from getting into contact with infectious droplets from other infected individuals compared to not wearing a mask. Also, using mask improperly can increase infections and reduce feelings of safety. For the 5 pillars guidelines before entering to PGH, first, the hand hygiene. Sanitize your hands every time you go in and out of a group environment and every couple of hours while you are in it. The second one is the physical distancing. Stand the prescribed distance apart on escalator and elevator lines. No more than 6 people on elevator. Turn as many internal meeting, patient visits, and town huddles into video meetings. The third one is the daily screening of all employees, patients, and visitors for symptoms of COVID-19. The fourth is wearing masks in and out of the hospital. And lastly, embrace culture, desire to keep others safe, not just ourselves. For the present time, the PGH follows the same high level of precautions, appropriate masks, PPEs, and physical distancing. Indoor parties, outings, and similar less essential activities are still not allowed, and second COVID-19 booster is required. Who needs to be swabbed? The person who needs to be swabbed is the person with any symptom possibly compatible with COVID-19. For the symptoms, here is the list. First is having a fever, the temp 37.8, cough and or colds, sore throat, shortness of breath, vague symptoms like weakness, muscle pains, anorexia, nausea, and vomiting or diarrhea, headache, altered mental status, patients unvaccinated, patients with incomplete vaccination, households or workplace exposure to no confirmed COVID-19 case in the last 21 days. For admissions with COVID-19 positive test results, patients with COVID-19 positive test results should remain at the isolated room for a maximum of only 4 hours. If COVID-19 is mild, discharge with instructions to home. If COVID-19 is moderate, evaluate if patient can be sent home. And if COVID-19 severe or critical, admit the patient to COVID bay floor. Limiting exposure to those who have or might have a contagious disease, isolation, and quarantine contribute to public safety. People who are ill with a contagious sickness are isolated from healthy individuals. For admission, patients with COVID-19 negative test result is not required to have swab. For patients whose initial COVID-19 test is negative but still highly suspected to have COVID-19, maintain isolated and repeat an RT-PCR immediately. If the test is negative, it signifies that the sample did not contain the COVID-19 virus, even though it is probable for some individuals with COVID-19 to receive a false negative result from this test. When the sample was taken at the early stages of your infection, you could test negative. Additionally, you might have been exposed to COVID-19 after your sample was taken and subsequently contracted the virus. People who get infected with COVID-19 but do not exhibit any symptoms, for instance, may not produce enough virus to result in a positive test. It implies that even though the result was negative, you can still have COVID-19. The COVID-19 RT-PCR test is a test designed to detect the virus that causes COVID-19 in the following respiratory specimens, like the nasopharyngeal swab, oropharyngeal swab, anterior nasal swab, mid-turbinate swab, sputum, lower respiratory tract aspirate, bronchoalveolar lavage, and nasopharyngeal wash aspirate specimens. For all patients who will undergo outpatient consultations and treatments, first, the patients need to update their COVID-19 vaccines, including boosters. Second, staff to wear level 2 KN95 plus eye protection and observe at least 1 meter distance. Level 2 refers to locations with restrooms where healthcare professionals can take a shower after work. They need the same level of protection as Level 3, although face shields are not required. Level 3 consists of cap and goggles or face shield and 95 mask, gloves, gown, or coveralls. For patients with OPD special procedures, no need for COVID-19 testing if he/she fulfills all. Adult patients fully vaccinated with booster, pediatric patients fully vaccinated 2 doses. And that's all. Thank you.